Water for Despor and Sylvania by September. Canadian Hunger Fund stresses the importance of fresh produce standards, and after 6 years, coordinator of the Yes We Care program says the program is doing exceptionally well. Thank you for joining us on another edition of National Focus. I'm Nisha Charles.
And I'm Kerdisha. Stay with us for details of these and other stories after the break.
You're watching GIS.
Thanks for staying with us. The communities of Despor, Sylvania, Sultan and Corona Estate will be getting pipe-borne water by the end of September this year. The Honourable Minister for Water Resource Management, Reginald Austrie, updated the nation from the House of Parliament last Wednesday, May 27th.
Works on the extension to Sylvania have begun, Madam Speaker, and at this time is about 80% complete. The 2-inch distribution pipes within the community of Sylvania have already been laid, while preparations are being finalized to begin laying of the 4-inch supply main from Pocasset to Sylvania. This phase of the project is expected to be completed by the end of September 2015, by which time Sylvania, Despor and Corona will receive pipe-borne water from the WASCO. Madam Speaker, to note that with the exception of Despor, these communities will be receiving water for the very first time in their lives, Madam Speaker.
Residents of those communities have been promised a reliable water supply system by their parliamentary representative, Rayburn Blackmore, and Prime Minister Roosevelt Skerrit. When he addressed the community at a meeting last September, Honourable Blackmore explained that the Bell's water supply system will allow for residents of Despor and surroundings. The Layo community was also promised a reliable source of pipe-borne water. That water will come from the tanks constructed in Pocasset and Bells with a combined storage capacity of 75,000 gallons. Honourable Austrie gave an update on that project, which has been delayed due to equipment challenges.
The part is now being sourced, and we also have plans to purchase a new machine for that purpose, Madam Speaker. As a result, it is anticipated that the completion of the extension to Layo Park and Sultan will be sometime around mid-November 2015, by which time the residents of these communities, Madam Speaker, will be receiving water for the very first time under the Dominica Labour Party. This project, Madam Speaker, is costing the government some 6.34 million EC dollars. And on completion of that project, Madam Speaker, almost 100% of the residents of this country will have access to pipe-borne water.
And so, Kerdisha, here we see the importance of water. You know, in 2000, the Millennium Development Goals, which were put in place by the United Nations, their goal was to halve the proportion of people living without pipe-borne water by 50%. And here we see that by September, Dominica would have access to 100% clean potable water. And
that's right. You know, not only is it important for the Millennium Development Goals, but it's also a part of the Labour Party manifesto that they will be, you know, trying to get 100% of access to potable water on the island, and that says a lot. And I know myself, being a resident of the Sultan area, it's quite vital, you know, the importance of water, because a lot of the people there have tanks, you know, which are good, but you know, during the season, for example, you know, the dry season just passed, when the water is gone, it's very hard to get access to water that we need, you know, just, you know, to have in our houses, to have in our gardens, you know, etc. So, you know, it's quite a great thing that we'll be now having potable water that we can access all the time.
And you know, water is not just important for drinking or doing laundry or cleaning, but it's also a great part of health. You know, we see that where there's access to clean potable water, we see the lower rates of diseases occurring.
That's right. So, you know, kudos to the government for this initiative. And I know for sure that by the end of 2015, you know, all areas of the island will have access to, you know, potable water. The Canadian Hunger Fund, CHF Caribbean, is stressing the importance of fresh produce standards as a critical aspect of regional trade. Agribusiness and Marketing Coordinator of CHF Caribbean, Dr. Nadia Paquette Ansel, says standards are of utmost importance if Caribbean nations are to benefit from regional and international trade.
The fresh produce standards highlights key commodities that are being traded regionally. Dr. John alluded to the fact that the opportunities that present itself across the region provides an opportunity of $4.5 to $5 billion worth of trade. Our import bill is significant within the Caribbean region, and CHF is seeing it as an opportunity for enhanced trade among territories of the region, and not only for export extra-regionally, but we recognize the importance of trading among member territories and improving on our enhancement. As we note, the banner accompanying measures is here to actually promote the enhancement and the competitiveness of agricultural trade, and we see it fitting to partner with these organizations today to highlight the importance of fresh produce standards as an important and pivotal instrument for enhancing the quality of fresh produce entering those markets.
CHF Caribbean is implementing the promotion of regional opportunities through enterprise and linkages Propel project. The project is being implemented in 8 Caribbean countries, namely Dominica, Jamaica, Barbados, Grenada, Guyana, St. Lucia, St. Vincent and the Grenadines, and Trinidad and Tobago. Dr. Paquette Anselm expounds on the project.
The project's aim is to actually enhance the quality and volumes of fresh produce, leaving our producers, our smallholder farmers, into what is called the HVMs, high value markets. And the high value markets can be defined as supermarkets, hotels, some certain types of restaurants, cruise lines, and of course the export markets. CHF is partnering with a number of local entities across the Caribbean in its 8 beneficiary countries to implement issues regarding production, quality standards, and provides technical supports in various aspects to producers, producer groups, and organization-based organizations such as the Ministry of Agriculture and those implementing standards across the member states' countries.
Paquette Anselm was speaking at the handing over of equipment ceremony last Thursday.
One of the primary concerns of the Dominica Labour Party government has been to ensure that senior citizens and the underprivileged do not fall through the cracks. One of the programs devised to reach those needing help is the Yes We Care program. The program, which facilitates personal home care to the elderly and handicapped who are housebound, was initiated by Prime Minister Roosevelt Skerrit in 2009. GIS News sought to find out the progress of the program over the past 6 years. We spoke to coordinator of the program, Mathilde Royer, who believes that although there are challenges, the Yes We Care program has so far been exceptional.
We have persons who could not walk, who are now ambulant. They can walk on their own because of training. We give caregivers ongoing training. So the training that they got, they put it into practice, and the people can now walk. Some of the homes are in terrible conditions. And because of the program coming there, we're able to get housing to do some renovation, although we still need a lot to be done in that line. That is one of our challenges, housing. But the houses, we got them renovated, got something, some of them were rebuilt. Some of the people had no water, which is also still a challenge, but we were able to get water, electricity, and those things again. And the companionship, these people had no boy to talk to. And then the carers would come there and, keep them company, and that alone is enough for an elderly person, When you're there a whole day with nobody to talk to, they would give them all kind of stories and so that is a lot.
At the inception of the program, 249 clients were signed on. Currently, the program serves 151. Royer details the factors affecting the numbers.
You have persons going to the infirmary, persons dying, relatives surprisingly removing persons from the program. So it's an up, down, thing, but we are now on 151.
Roy explained that because of the program, several relatives of those receiving care have taken the responsibility of caring for their own, and this has led to several clients being removed from the program by family members. However, she assures that the reduction in the number of clients has not had a negative impact on the number of employed to run the program.
When we started, each caregiver had about 6 to 7 clients. And if you really have to give care, full care to these people, that number was too much for one person. So what is happening now is that they get better care because they have less clients to deal with. So they can give more time to the person. Because imagine you have 7 clients to deal with from 8 to 4. you can't give that amount of time to each person.
The Yes We Care program has a total staff of 58, 4 in administration and 54 on the field. Roye says she is very satisfied with the work of her well-trained staff. She says the staff has undergone training in areas such as aging process, healthcare, pedi and manicure, and nutrition. Meantime, the program coordinator says there is need to take care of even more clients under the program. She made an appeal for members of the community and the village councils across the island to assist the program in that mission.
Persons in the village councils and the health team, the health centers and so, should be able to report to the program if there are persons in their communities in need of this program. Because what we find is when we go out there, we still see, although this program is on for 6 years, we still find persons out there who are in dire need. So we are appealing to the people in the village councils and health centers or so, to if they come across cases of such nature, to bring it to attention.
The coordinator says she is convinced that the program is very much needed and is optimistic that it will remain functional for years to come. The Yes We Care program costs government about $1 million per year. You're watching National Focus. Still to come, government receives commendations on improvements to feeder roads. Stay with us.
Did you know the Caribbean Court of Justice is 2 courts in 1? The CCJ has 2 functions: an original jurisdiction, which deals with your right to move between CARICOM countries freely and your right to move your money and your business. This is the basis of the CARICOM Single Market and Economy, CSME, and the revised Treaty of Chaguaramas, and an appellate jurisdiction to hear appeals from courts of those countries which decide to use it as their final court of appeal and no longer go to the Privy Council. All CARICOM member states who have signed the agreement establishing the CCJ are members of the CCJ.
Thanks for staying with us. The Honorable Finance Minister has responded to a question posed to him by members of the opposition regarding the financing and expenditure of funds for the multi-purpose identification cards. According to Prime Minister Skerrit, the Electoral Commission requested $3,635,000.68. That sum was for equipment, maintenance, and consultation fees for the MPID system. He detailed that for the financial year 2013-2014, $2,697,570 was spent. In the following financial year 2014-2015, $937,498 was expended. He gave a breakdown of those changes for that financial year.
An amount of $937,490 was requested for the administration of the multipurpose identification system, to include emoluments, operations costs, purchase of equipment, and maintenance fees to the suppliers for the financial year 2014-2015. A total of $163,014 has been approved for the financial year 2014-2015. A total amount of $3,085,078.30, of which $3,037,256.30 has been spent on the implementation and administration of the multipurpose identification system, to include purchase of equipment, emoluments of enrollment officers, consumable supplies, legal fees for consultancy on legislation, public relations, and maintenance fees. The balance of $47,822 was spent for the voter management system for the period April 1, 2013 to March 31, 2015.
That sum included a budgetary allowance of $163,014.
The Honorable Minister for Commerce, Enterprise and Small Business Development, Rosalind Paul, is commending the government of Dominica for the significant improvement of access to feeder roads across the island. During the second meeting of the first session of the 9th Parliament last week, Honorable Paul stated she believes that the improvement of roads will assist in the development of communities.
public works and our improved road networks, they help to develop the rural communities. They also help to position the communities in terms of community tourism, agritourism, and the farm access roads are critical to ensuring that we have improved agricultural production, food security, availability of fresh foods. And we cannot, the access or community access roads are not in isolation. So when we talk about productive, the farmers also use the improved roads. And as I said, it helps the community in terms of total development, including economic expansion.
The Honorable Minister notes that the road development has also benefited local persons within the communities in terms of employment, income, and being able to provide for their families. Honorable Paul says that improvements of infrastructure is not an isolated event, but has various linkages which benefit the entire nation.
Development is holistic. When you improve the quality of life, when you provide education, you are also creating the base for human resource development and for improved productivity in the future. When you improve roads, you are also laying the base, ensuring the enabling environment, the infrastructure for economic expansion. So it's not in isolation.
The minister is elated that a large percentage of the work has been done by local contractors.
I am very proud to see that in fact 88% of the sources of funds are from local funds, our own funds to be used for our own development. Speaking of increasing independence, speaking of resources being put back into our economy from our own local funds.
And that's the English news. McPherson St. Luce is next with the Creole highlights.
Alors tout le monde, bienvenue à cette nouvelle en créole. Non, moi, c'est McPherson St. Luce. Premièrement, ministre de l'Agriculture qui a appuyé assistance aux consultants qui a assisté au gourmet au compte aux maladies qui a affecté PAM et puis coco. Parole celle-là sorti hors officier quarantine ministre de l'Agriculture, M. Sylvania Ansem. Magui maladie celle-là pourquoi en Dominique, ministre là qui a mis en place si en tous les cas.
Comme ça va, ministre de l'Agriculture qui a collaboré avec toute organisation, FAO, AICA, CADI. Bon matin, là, nous bien contents nous collaborer avec USDA et EFIS. Avec USDA, c'est l'organisation agricole l'Amérique. Avec EFIS, c'est l'organisation qui a gardé compte plan quarantine avec bête. So, nous bien contents, monsieur Wendechi, Dominique, avec ça qu'il a fait Dominique, il a mené nous 400 traps. Mais ces traps ça nous a fait, nous fait surveillance. Tout le monde Dominique pour nous garder si nous avons une maladie en Tibet qui a affecté PAMS pour nous.
On s'est fait parole qui aussi vous traitement hot consultant là.
Ça en Aruba, ça en Curaçao, ça en région, Ija train des offices à nous. Yo te allé Trinidad garder comment yo ka faire surveillance ça dans Trinidad comment yo ka identifier pas mourir ça là. So nous bien content Wendy Chivini Dominique, il joint ministre bon matin avec permanent secretary director agriculture il ba yo c'est trap ça pas mourir trap aussi il travaille avec food fly avec USDA nous food fly trap c'est l'os là pour nous faire comment nous gagner comme ça. So nous bien content ministre agriculture nous les oui merci United States of America pour travailler pour nous garder comment nous gagner contre maladie cette idée là qui a affecté ces plans.
On a nouvelle gouvernement Dominique Katchen pour mettre effet bas Dominicain. Parole celle-là sorti hors ministre management de l'eau, Honorable Reginald Ostring. C'est l'homme ministre Ostring, Communauté Despor, Sylvania, Sultan, Ipi Corono Estate, qui a payé de l'eau par septembre l'année salam. Le ministre a fait parole salam pendant qu'il était répondre aux chèques sur le Parlement la semaine passée. Résidents et communautés salam qui a tapé pour mettre un bon système de l'eau. Même le Parlement a eu Honorable Ribbon Blackmore et puis Premier ministre Honorable Roosevelt Skerritt. Ces communautés salam qui a expecté pour brancher un système de l'eau belge. Communauté là aussi qui a tapé pour mettre un bon système de l'eau. En d'autres nouvelles, l'occasion Park House, ministre agriculture, c'est pour taper bon standard pour habitants. Parole celle-là, sorti du directeur agriculture, Ricky Brumand.
Un programme projet avec Dexia, Park House là, c'est posé mener un environnement comme quoi nous ça pas manger, nous ça sort manger, nous la grade manger pour faire santé, manger qui quitter produit qui quitter pays nous encore qu'à joindre ça nous a standard international. Ça nous a créé parking house là, c'est pour ça un produit qui ça joindre toutes ces qualités standards ça, monde qui a exporté, monde qui a produit, ça vient ici, fait affaires pour certains. Nous à Dominique, nous avons bonne place en les marchés l'autre pays.
Et puis, finalement, le ministre de la Santé a gardé bien pour manier crise en violé et puis bagaille sexuelle, car aussi pour attention en pays là. Plaisir officier, ministre de la Santé en collaboration et puis paro, j'ai une consultation pour revisiter bagaille qui a concerné l'abussement sexuel en Dominique. Quand même si l'on permanent secrétaire ministre de la Santé Helen Royer, bagaille sexuel c'est un gros problème tout partout, et puis c'est bagaille qui a concerné autant en Dominique. Royer dit problème ça mérite taper attention, raison pour te chaîne consultation à soin. Et des sujets ça là supposé bien adresser, et puis monde qui affecté supposé taper attention. Ministre de la Santé, Honorable Dr. Kenneth Darrow, supposé taper un document de consultation ça là ou mener en cabinet. Messieurs, mesdames, ça c'est toute bonne nouvelle en créole pour à présent. Non, moi c'est McPherson. Au revoir.
Coming up next, your tip of the day. Are you having trouble sleeping? Why not try massage therapy to give you that deep sleep and relaxation?
Massage has been shown to improve sleep in infants, children, adults, and the elderly alike, as well as individuals with cancer, heart disease, lower back pain, and breast disease.
And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website news.gov.dm.
Like our Facebook page, facebook.com/GIS News Dominica, and follow our Twitter at GIS Dominica. You can also catch up on a past National Focus newscasts on our GIS Dominica YouTube channel. From all of us here on the GIS News Desk, I'm Kerdisha St. Louis.
And I'm Nisha Charles. Thanks for watching, and do join us again next time on National Focus.